You know, Collin County, we don't have a county hospital. We don't have a psychiatric hospital. So the biggest psychiatric hospital is the county jail. Today, this morning, I have about 1,380 people in custody.
Collin County Sheriff Jim Skinner says at least 40% of the people in his jail have developmental disabilities or are struggling with mental illness.
The mental health crisis alone has gotten so bad that the cells that were occupying inmates with medical issues and then some mental health issues have eventually made their way to our special housing units, which really weren't designed for that purpose. It's not ideal, but it's the only place that we have to put them. So I'll show you just what it looks like up closer. These are really designed for inmates under restriction for disciplinary reasons, but unfortunately there are so many inmates that were overflowing from our medical unit that we can't even put them in the most ideal situation outside of that. We have to put them in disciplinary cells that are truly not designed to hold an inmate with those kinds of issues. These fences that we put up were to keep the inmates who are on suicide watch or with severe enough issues we had concern that they might be suicidal from jumping off the second tier.
Every person booked into the Collin County Jail gets a medical and psychiatric screening. Dr. Trina Bivens is the lead psychiatrist.
I've been a psychiatrist for 30 years. The Constitution allows for a person or requires that a person be competent to stand trial. If the question of competency comes up, an evaluation is done, and the judge may determine that you're incompetent to stand trial right now and you're going to need treatment.
Inmates that need to be admitted to a psychiatric hospital are put on a forensic wait list. As of May, there were about 1,700 people in Texas on the list. The average wait is 6.5 months for a minimum security bed and 8 months for a maximum security bed. In many cases, that wait is longer than the potential sentence.
One issue we have in jail is that some people with criminal trespass, which is a Class B misdemeanor, just above a traffic ticket, didn't involve any harm to anybody or hurt. They didn't steal anything. They're just kind of loitering somewhere where someone doesn't want them.
The maximum sentence for a Class B misdemeanor is 180 days in jail. Bivens says people battling mental illness serve that time before ever getting to a hospital.
We see they're very psychotic. They need treatment. I can't make them have treatment. The DA pursues a competency finding on them, and we're all basically stuck for 180 days till they time out on their charge, at which point I file a emergency detention order, and they're taken to a hospital civilly.
Tarrant County Sheriff Bill Wayborn says there are not enough hospitals to help everyone who needs it.
We need more bed space, and we need more maximum security bed space too. We have 2 inmates right now that have been with us for over 1,000 days because there's not an opening for a state bed with the level of security that's needed.
I oversee the most difficult situations and the patients who are having the most difficulties.
Dr. Carol Maddie is the Chief Medical Officer of My Health, My Resources, an organization that provides mental health care inside the Tarrant County Jail.
So one thing that we try to do is competency training while here in the jail to get people off the wait list as soon as possible. We work very closely with the assistant district attorneys in order to make sure that they know there's some people who will never become clear enough to handle their charges, and those charges either need to be dropped or disposed of in a different way so that the person is not just sitting here in jail waiting for a day that will never come.
The lack of beds isn't just bad for those in jail. In the first half of this year, state numbers showed nearly 1,200 people tried to voluntarily admit themselves to a state psychiatric hospital. A third of those were turned away. Jail officials say that is where the problem starts.
So if those elements are failing, kind of the last ditch effort is then always going to be the jail, and that they can wait at the jail, wait for a bed at the jail if none of the outpatient elements are there.
I think people in the community need to be aware of the issue so that we put resources and our tax monies where it's most needed. And the reality is I don't like paying taxes, but when it comes to the need, I want people to get the treatment that they need outside of an incarcerated environment.
Everybody knows someone that suffers from mental illness. Everyone has seen somebody who, when it goes untreated and it gets worse and worse, bad things can happen. And when bad things happen, we show up. It is something that as a society, we need to recognize and we need to face and we need to deal with it.
It's an absolute eye-opener. If you were here last night, we welcome back again I-Team producer Kelsey Mitzauer. So much to unpack with all of this. What was the big takeaway, you think, for you?
Well, I think we started with looking at jails, right? We went to the jails about this, but then, like the numbers from the state show, the problem really lies in the public health system before anybody gets to the jail.
Right.
Both the sheriffs and the psychiatrists say that if there were better options for the public, a lot of these people wouldn't even end up in jail. There needs to be more of an option for someone to get treatment on their own, or a diversion program. Maybe if somebody comes in and they are under arrest, they can be diverted to treatment right away instead of spending months in jail.
Right. That makes sense. So much finger pointing that you have discovered at the state level. What do state leaders say that you've been able to contact?
Yeah, so it's the Texas Health and Human Services Commission that oversees the state hospitals. They didn't want to interview with us, but they basically said, we're working on it. They sent me to a link with a map that shows they're adding hospital beds. These are the cities right here. You can see where they're either expanding hospitals or they're building new hospitals. And so they're saying that when all these projects are done, it's going to add more than 680 new beds across the state. So that will alleviate some of it. And then some, yes.
Yeah.
And then in Tarrant County, actually, Sheriff Wayborn talked about there's a private hospital in Arlington. So it's not state run, but they've opened up 36 beds for low or medium risk inmates. And so he said that's helped a lot of their issues.
And that's literally them stepping forward, a little bit of a collaborative effort, right, with the county jail.
Yeah.
Wow. It's such an insight. Kelsey, thanks so much.